Welcome to Rwanda Medical Academy. Today's lesson is about understanding substances causing hypertension. And we will use the mnemonic CT scan to help you remember. Introduction. Hypertension or high blood pressure is a prevalent medical condition that significantly impacts public health worldwide. Understanding the substances that can contribute to hypertension is essential for healthcare professionals to provide accurate diagnosis and effective management strategies. In this course, we will explore the CT scan mnemonic, a useful tool for remembering substances known to elevate blood pressure. Each letter in the mnemonic represents a substance with hypertensive properties. By studying this mnemonic, you will gain insight into the mechanisms by which these substances affect blood pressure, their clinical presentations, and the clinical considerations associated with their use or exposure. Let's begin our exploration of substances causing hypertension with the CT scan mnemonic. C stands for cocaine. Cocaine stimulates the sympathetic nervous system, leading to vasoconstriction and increased heart rate. Mechanism: cocaine blocks the reuptake of norepinephrine and dopamine, resulting in increased sympathetic activity and elevated blood pressure. Clinical presentation: patients may present with tachycardia, hypertension, chest pain, and agitation. T stands for thyroid supplements. Excessive intake of thyroid supplements can increase metabolic rate and cardiac output, leading to hypertension. Mechanism: thyroid hormones stimulate beta-adrenergic receptors, increasing cardiac contractility and heart rate, thereby raising blood pressure. Clinical presentation: symptoms may include palpitations, sweating, weight loss, and heat intolerance. S stands for sympathomimetics. Sympathomimetic agents mimic the effects of adrenaline, resulting in increased heart rate and vasoconstriction, contributing to hypertension. Mechanism: these substances stimulate adrenergic receptors, leading to increased cardiac output and peripheral vasoconstriction. Clinical presentation: clinical signs may include tachycardia, hypertension, sweating, and dilated pupils. C stands for caffeine. Caffeine stimulates the release of catecholamines, resulting in increased heart rate and vasoconstriction, leading to elevated blood pressure. Mechanism: caffeine blocks adenosine receptors, leading to increased sympathetic activity and elevated blood pressure. Clinical presentation: patients may present with palpitations, anxiety, tremors, and elevated blood pressure. A stand for anticholinergics and amphetamines. Anticholinergics and amphetamines induce sympathetic activation, leading to increased heart rate and vasoconstriction, contributing to hypertension. Mechanism: these substances block muscarinic receptors or increase the release of norepinephrine, leading to sympathetic stimulation and elevated blood pressure. Clinical presentation: clinical manifestations may include tachycardia, dry skin, dilated pupils, and agitation. N stands for nicotine. Nicotine stimulates the release of catecholamines and promotes vasoconstriction, resulting in increased blood pressure. Mechanism: nicotine activates nicotinic receptors, leading to increased sympathetic activity and elevated blood pressure. Clinical presentation: symptoms may include palpitations, increased heart rate, vasoconstriction, and agitation. Thank you for learning. Join and save a life with us at Rwanda Medical Academy.